Being involved with Macmillan, I've been involved with him for many, many years because as a nurse previously, I knew a lot of Macmillan nurses. But I suppose with my husband John, that's an entirely different sort of arrangement. I got to know about them in 2013 when John was first diagnosed with lung cancer. We had a Macmillan nurse, and I have to say, she's one of the best things that ever happened to us. She was brilliant. The surgery that he had, the follow-up treatment, the chemotherapy, he was positive from the word go. I don't think there was ever a time really when he thought it's not worth bothering with. But in a very short time, things went downhill quite quickly. So he decided then he wouldn't have any more. We got him to a Bwthyn. The staff there were absolutely brilliant, even though we hadn't met any of them previously. Welcoming and so sensitive to the situation. We were there and John died fairly quickly after we'd arrived at Bwthyn. There was no rush for us to do anything. We were just taken to a nice quiet room as a family, left on our own for a while, which is what we wanted. We felt that everything was in place. They were extremely supportive. And for me, it's nice to think that the majority of the staff that are there are going to be supporting the new facility. This building is not going to be your normal hospital building. Someone from Macmillan suggested that I should go onto the project board. All the people around the table, Macmillan staff, health service staff, they are all people now who understand terminally ill patients and their needs. But you've also got facilities for the relatives to stay or break away into other rooms as well, because sometimes you do need a bit of space. Even the artists have been going to a Bwthyn, speaking to them, asking them what's good about things, what would they like to see done differently. So when you go in, you'll have a feeling of calm. The amount of work that's gone into producing something that's going to be invigorating, really. I think if you're looking after someone that is dying, and the family and the needs, everybody's different. So I think all of those lovely facilities are going to make a difference to the staff, there's no doubt, but also to the people who are there. I think it's important that people die with dignity. It's what he wanted, and we all pulled out all the stops. Certainly Bwthyn pulled out the stops, and we as a family did as well, to make sure that he got what he wanted. And there you walk away then with a feeling of satisfaction that you can't do anymore.